The real question I have to ask myself is this really medically necessary? Do I need prior authorization for this speech? And if so, will I get denied by the algorithm, Jonathan?
The article explains how insurance companies outsource their denial or approval of claims for pre-approved medical procedures. Companies like Evicore that use an algorithm to sort through the requests and approve most of them, but if it sees any possible discrepancies or anything they don't like, they shunt the request for the review of a doctor. These doctors have about 4 minutes per review generally, and 4 minutes is not a long time to get a case reviewed to approve or deny it. It requires a doctor to deny a request. So the company makes money with every denial. The requests have to be denied again by a doctor. Some of the company's medical personnel report that they were given requests for service that were not in their area of expertise, i.e. a cardiologist reviewing a gastrointestinal or oncology request. This is a long but disturbing article. The story is from ProPublica by T. Christian Miller on October 23rd, 2024.
So, is this medically necessary? To be run by the algorithms, to be run up the dial, and to be denied by somebody who, frankly, doesn't have a clue. I mean, yes, they'll have some medical clue, but you're not going to have a clue if you're a podiatrist talking about, stomach cancer now, are you? I mean, this is the level of what we're talking about here, because these doctors who work there, they're going to have multiple specialists. You're going to have dermatologists, you're going to have gastroenterologists, cardiologists, pulmonologists, endocrinologists, etc., all doing these things that they enjoy doing and thinking, I'm going to go and do my bit to help the American healthcare system. If you think you're doing your bit to help the American healthcare system, help dismantle the American healthcare system, but that's a discussion for another day, because the American healthcare system, as it currently is constituted, needs a good root and branch rip up and start again, as I have found through my time living here. So, AJ, do you enjoy the American medical system?
I have ample experience with the American medical system. I have a whole lot of health issues myself, and so I have actually personally had experience with these type of requests, because my insurance is an HMO, so you are required to submit pretty much for pre-authorization for anything you want to do. And
a health maintenance organization. Isn't
right,
that great?
It's the worst. Yeah,
isn't that great?
The best one. the best worst. So I had, for example, I have a pain condition, right? It's very painful. It will affect my leg. I couldn't walk. I had to be on crutches, sometimes in a wheelchair. And there were times where I would need a nerve block. And so my doctor would submit the request for the nerve block, and they will deny it. And we would look into it. And it was just such dumb things. Often it would be like a small wording, or like, oh, you're going to use this type of anesthesia. No, we don't cover that. So they deny it just because they were going to use some type of anesthesia that wasn't under their specific, I guess under the dial, maybe the dial that's mentioned on the article. So yeah, it's a mess. And I had this happen so many times, and you get tired of having to appeal and having to try again and again for something that's, you're in extreme pain. You're like, I hope I can have this procedure in the next few days, but no, you have to wait weeks, sometimes months.
Yes, so you remind me of a friend of mine, and I'm allowed to talk about this because they posted this publicly on social media, that they have a medical condition. They have Crohn's disease, and they have a $30,000 drug, but that's the list price of the drug before insurance comes in. And without this drug, they will die. Straight up, they will just die. Because, Crohn's disease in its severest form means you just cannot digest and absorb nutrients from your food. You just can't do it. So they recently denied her. Same drug she's been getting forever. Same drug she'll need until the day she dies. Nope, don't need it this time. It's not medically necessary, they say. Just because. And then they resubmit it. Oh, no, you're going to have to resubmit that again in 90 days. And then the third time, oh, yeah, just have it. No rhyme, no reason, no understanding of the ins and outs, no conclusion here or anything. It's just the whim of a computer. the whim of the administrator, because they have sent it from being rubber stamped to denied. I don't care what they say. Oh, it gets denied by a doctor. The delay is denial. Sending it to the doctor is a form of delay denial, and you have to accept that some of these things will kill people, like the gentleman in the article. He died because they said no through delay. And delay, and delay. And he is dead now. The American healthcare system is sometimes the American death care system, because it is just there to facilitate people not to get better, but to be money milked, and then they die. So, Jonathan, you've got a slightly different view on this. You're a member that can access the Veterans Affairs Department, if I'm accurate here. So how does it work there?
Well, the VA is a different system. It's a government system, and if you have a service-related injury or condition, it's rated. It's given a percentage disability rating, but you can go with no if you just have health issues and they're not related to your military service. You can still use the VA, but you're going to be charged a nominal fee for things, and sometimes not so nominal. And you're going to have to pay for a lot more of your medications and things. But if you're like me and have a high enough rating, most of it's free, and you get priority for appointments and that. So it's not really a perfect system, because not everybody gets treated the same, and not everybody gets the service in the same rapidity that someone like me would get it. But it does work fairly well. The VA hospitals I've been at, some of them were okay, others were outstanding. I happen to live in an area with an outstanding hospital here. They've taken care of me through a lot of serious problems, and I've come out more or less on top, if not completely intact. So it's been a good experience for me. A lot of people don't like the waits. The appointments can be a little bit hard to get sometimes. But they've been improving on that over the last 3 years, and things have gotten a lot better. There's not as much of a backlog on determining if you're service connected or getting your rating. And it's not as difficult as it was when I first got mine. So but it's still not an easy road, but the attitude has changed to, like, let's see how we can help this guy, rather than let's pick apart whether or not we should help him. So it's been very good. I think that it can be a somewhat of a model for what could be a universal healthcare system with some tweaks and changes to it. But I'm just glad I have it, because it would be impossible for me to afford anything close to what I have to do now.
So the three of us come from three very different backgrounds when it comes to interacting with healthcare. I come from Britain, which has the National Health Service, free at the point of use. AJ, you come at it from an HMO, and Jonathan, you come at it from the Department of Veterans Affairs. So why are so many Americans comfortable with this as their healthcare system? Why are they so comfortable with this as their healthcare system, AJ?
I don't think that they're comfortable with it necessarily. I think there is so much going on in our country and, in our personal lives at all times, that at some points we just have to choose, right? Do we put certain issues aside and just deal with it? We often feel that the problem can be so massive that our individual fight back is just not enough to affect any kind of change. And, I feel this way, because of all of the health issues that I have. Not just the pain. I have I'm deaf. I have issues with my eyes. I've had corneal transplants. I've had nerve stimulator put in. So I have gotten good care. When it is approved on time, it's good. But yeah, it is definitely does bring a lot of stress sometimes to the way that you have to jump through all these hoops in order to get that type of care.
So, kind of someone who comes from Europe, where, healthcare is, considered to be, one of these things called a right, not, a luxury, as it seems to be in America, or worse, an employment perk. Woo! Aren't we pleasant in America to have a healthcare as an employment perk? This is bonkers to me. This is absolutely bonkers to me because it flips the whole system on its head because you're not giving a toss about the patient here. And especially as these companies like Evicore, or they should be sometimes called Nevercore.
Evilcore works too.
Yeah. So
Evicore,
when Nevercore / Evilcore / not Evercore decide that they're going to take on these companies' contracts, and then you see who the parent company is, which is Insurance
Cigna.
Conglomerate LLC, or Insurance Provider LLC, or Chemist.
In Evicore's case, it's Cigna, which is a very large insurance.
And in another case, it's Aetna.
Yeah, I was going to mention that. That to me, that was like the worst part. It's like all these giant companies were all interconnected. Like you said, Evicore is run by Evernorth, which is a brand of Cigna, which is the insurance giant. And then the next big player that does the same job as Evicore is called Carilion Medical Benefit Management. And guess what? They're a subsidiary of Elevance Health, which is actually the insurance company formerly known as Anthem. So it's the same company, just a different name. And
then you've got Aetna getting on the action. Then Aetna getting on the action with another company. And then, do you know what makes this so egregious when it comes to Aetna? Aetna own CVS pharmacies. Aetna are the parent company of CVS pharmacies. So your pharmacist is in the same group as the people denying you your drugs. Think about that for a second.
Yeah, they're there to benefit each other.
They are in each other's pockets. And they've got their fingers in each other's pies. This is how ludicrous we have allowed the American healthcare system to go. And it's not a design flaw.
No, it's intentional.
It's an absolute design outcome of all of this.
It's a design attribute,
It's a criterion to maximize. Because at the end of the day, the three of us are not humans as far as they're concerned. The three of us are a price tag.
Yeah.
The gentleman in the article who is dead was a price tag. And we know they're a price tag because when they tried to sue them, their price tag to be sued was too great. I find it quite weird that the doctor is being sued here when the doctor went, do the healthcare, and then they went, no. So now the family's suing the doctor who wanted the procedure to done because they're the bottom of the ladder. Yeah. And you wonder why in America there aren't enough doctors.
The hospital and the doctor can be sued, but you have to sue the other people in federal court, which is a whole nother animal. And they have a lot of case law that denies those kinds of things behind it. So until we can get judges with a sense of morality, about things, and it's just going to stay that way.
Good luck with that.
Good luck with that. Yep. Yeah, I mean, all these companies are just profiting and scratching each other's backs at the expense of the human beings on the other side, waiting for, often life-saving procedures. That's how it is.
The thing that bothers me the most is that all these billions and billions upon hundreds of billions of dollars that they're making could make it affordable for a universal healthcare system if all that money was just spent on everybody's healthcare. There is so much money they're making, but if you just got rid of all that management and profit and just put it into a system that's already there.
Yeah, but that is the whole goal for this Evicore type thing. Like they're structured to provide higher payout based on more denial. So they get a financial incentive whenever they achieve greater reduction in medical spending for the healthcare organizations that they're working for.
Yeah, here's a question for the two of you. Government-run programs are wasteful and inefficient, right? So
not necessarily.
How much, as an overall percentage, do you think Medicare spends on administration costs? As a percentage, what do you think the number is?
I have no idea.
I mean, I don't know. I will take a wild guess, like 15%. I don't know.
15%. Jonathan, what's your number?
I'd go 20.
2%.
2%?
2%?
Oh, wow. Okay.
2%.
Wait,
sorry, I was just off by 10 times that amount. Okay.
So Medicare in America spends 2% of the money it receives on administration costs. 2%. Whereas on average, the US healthcare system spends 13 to 19% on administrative costs, just on filling out paperwork, denying your requests. Computer algorithms like this. Government-run system, Medicare, 2%. US healthcare average, 13 to 19%. The government must be less efficient, right?
They're using like all these very complicated systems like AI and, like doing that like a whole algorithm, like what they call the dial. So yeah, I can imagine that they spend a lot of money on that.
Well, of course they do. So we all hear this. We're being overrun by the machine. How do we get the machine to stop running the healthcare system? Jonathan, AJ, how do we do that?
You make it a government agency that gives all the healthcare. You make it not a single payer system, but you turn all of these silly for-profit things into a non-profit thing or not-for-profit thing in the government, and that you take all those resources that those people had and you give them to this thing, and you give everybody a basic level of health care and any emergency health care or complicated health care they need to maintain their lives. And it shouldn't be a matter of where you are in the society, or whether you have billions or millions of dollars, or whether you have hundreds of thousands of dollars to drop on it, or whether you have to sell your house, your car, your go-kart and your boat in order to pay for 1 month's worth of medication. That's just, that's where it is. And the leading cause of bankruptcy in the United States is medical expenses.
Oh, yeah.
Oh, it's absurd.
Yeah, I've had several procedures that if it wasn't for the way that, like my insurance was set up, pay the complete out of pocket. And I always get everything done towards the end of the year, like in a hurry, because that's when I know that it's going to cover everything no matter what. But otherwise, I will be paying like $30,000 for just to get a replacement for my cochlear implant. The surgery itself was like $50,000. Like there's no way, people can afford something like that.
It's ludicrous. It's absolutely ludicrous. And if you have found this discussion ludicrous, you can find more ludicrous discussions in the link below.